Hi, my name is Stacey Pitts, and I'm the co-founder of CBD BioCare. And joining me is chiropractor Dr. Kidgell. And today we're going to talk about how CBD is used in the chiropractic industry, specifically in Dr. Kidgell's business. So, hi, Dr. Kidgell, how are you?
Hi, thanks for having me. I'm great.
Well, I'm really fascinated about some of the conversations that we've had and really how you've been able to incorporate CBD into your practice. So can you explain how and why CBD is working for your patients?
Well, how it's working is the basis behind CBD itself, and how I'm using it and educating the patients is one of its main properties is the anti-inflammatory properties itself. So in the chiropractic world, we are dealing with inflammatory issues, typically neuromuscular. So it doesn't have to just be an acute injury. It could be chronic injuries or chronic neuropathies and things of that sort.
And can you give me some examples of patients that are finding the most success?
Off the top of my head, I have seen extreme cases like rotator cuff injuries where we know we're going to end up needing surgery. We just, time and place and finances and jobs, maybe it just can't take place right now. So it's buying them a quality of life to not be completely suffering, or maybe not wanting to take opioids and things of really strong prescriptions. So that right there is just really, really big. And then acute car accidents, slip and falls. So then in that case, we could have a whiplash, a knee swollen, an ankle swollen, an elbow, injury, even falling off bicycles, or just picking up something too heavy at home. Or I have realtors that like to push couches and staging with their hips, and they're not designed and built for that. So they'll flare something and they'll use the CBD as the anti-inflammatory process, besides the fact of other things of getting better sleep and decreasing anxiety. And those are obviously benefits, not necessarily in my office, but in the general public.
How do you recommend the milligrams and also the serving sizes? Because that's one of the biggest questions that we get. So you've talked about several different examples. You've talked about acute pain, you've talked about chronic pain. So when do you tell someone to use the 750 versus the 1500? And how much do you tell them in terms of how to dose it?
Yeah, that's the trickiest question. When it's more of a chronic tolerable, and maybe they're just doing it over the counter, which obviously over long periods of time it can be damaging to livers and kidneys, they could probably use the 500 or the 750 milligrams bottles, and start with 3 to 5 drops, and then work from there and see how they do. If we're dealing with people that are on prescriptions regularly and they're just trying to either get more control over that, or have a decrease in the symptoms even around the medications and things of that sort, or the injury is acute, the accident or the fall is within days, they can do the 750 or the 1000 milligrams. Now, let's say you get the 1000 milligrams and you only need 3 to 5 drops, maybe once or twice a day. But if you get the 750, you may need a little bit more. So instead of 3 to 5 drops in the 1000, you're here having to take maybe 5 to 7 drops of the 500 milligrams a couple times a day. So when we go into the 1500 milligrams and the concentrations get higher, it's for really long-standing ill patients that have been dealing with life devastating, in my eyes, serious health issues that they're trying to manage, or increase their abilities with their activities of daily living.
Something we've noticed as well, and even for myself, I had a minor tweak in my back from a workout I did, and I thought, wow, this is so uncomfortable, and I didn't want to be taking traditional over-the-counter medications. So of course, I turned to CBD, and I noticed that I took a higher milligram at that time, and then I took it throughout the day, like where, a typical over-the-counter medicine would say take it every 4 to 6 hours. I noticed that I was taking the CBD, a higher concentration, I believe it was around the 1000 milligram, and I was taking it every few hours. So started to feel the pain come back, and I went ahead and took another serving. and did that several times throughout the day. And after a few days, I didn't have to do that at all. And I went back to my traditional once a day. So are you seeing that as well? Is that pretty common in your eyes?
What I'm finding in people that are either new to it or still nervous about it, which we can get into, um, they getting them to take it more than 3 times a day is a little bit tricky because they might only have a lunch break and they don't want to be doing stuff at their desk where maybe they're being monitored. And I think there's that societal fear of, am I being watched, maybe in large corporations and businesses where there's a lot of employees. But people like you and I, where we're, it's self-employed, we can keep it on our desk and we can take it at our free will. So I think it's unfortunately one of those things where you just have to be safe in your environment to decide how often do I want to take it. But yes, with the acute injuries, I'm finding that most people are taking it 3 to 4 times a day, and then um, mild issues, maybe just for sleep, they're just taking it before bed. And then people that are dealing maybe with anxiety and sleep, they'll do a morning and an evening. And so I wish it was just cut and dry, like the bath
Right.
over the counter, but it isn't.
I often tell people as well that the first bottle is an experiment. And I don't want people to take that the wrong way, but just like if you're getting on a new medication for maybe blood pressure or something, or even hormones, there's a little bit of a testing period, a testing ground, if you will, to understand how your body reacts. It's no different with an all natural product. And it's always interesting to me that we're so easy to take a prescription that our doctors give us without a second thought. I mean, not even reading the book that comes with it about all the, directions and warnings and instruction, all of that. But yet we are hesitant when it comes to something that is a plant, an all natural product that you can't kill you, you can't overdose. But it is a shift in our paradigm, right? It's a different way of thinking. And so I think part of why we're doing this is to educate people that this is a safe alternative, and it's a very effective. It's helping people get off more traditional medications, so it's a win-win. But there's still a lot of education and that needs to take place, um, for people to be able to embrace it.
And that's, I believe, all I'm doing on a daily basis, running into people in the public, like I just was telling you earlier today, and pamphlets and handouts and these videos to just make sure to share with our loved ones, and really, doing outdoor talks and whatever gyms and any place that will, be welcome and just want to learn.
The most important thing we can do is share our own testimony, when we're using it, and share how it's helping. So I love that you've been able to share some examples from your practice. Um, Another thing that we're really passionate about is being able to prove that we are a quality product. And that's why our certificates of analysis are on our website. We now have QR codes on our labels to make sure that people feel confident that we have a quality product, that's tested from plant to product, so that everyone feels safe, because it is an unregulated space, which also lends to some of the questions that people have. Why did you choose to partner with CBD BioCare when there's just new companies popping up left and right all the time?
That was some studying on my part, and it wasn't even as popular as it is now when I was trying to find the information. So that was a challenge in itself a few years ago. But I was looking for purity, third-party testing. I don't want all these fillers. I was looking for medicinal strength. I happen to know that the product taken orally is more highly effective than just taking it as what people are calling an edible or a gummy, or things that you can just buy here and there and you just don't even know where the product's coming from. And the fact that there are other companies that are carrying similar products, and if they're not third-party tested, I just don't even really go any further. But I would really wanted to be with a company that wasn't carrying hundreds of products. I wanted a company that was focused on the oil.
Well, we're really glad to have you. Thanks for your time today. And I'm glad that we're going to continue to work together and do more of these videos and continue to partner with spreading the good news of CBD and CBD BioCare. Thanks, Dr. Kristen.
Thank you.